Well, a blistering new report out of the UK claims thousands may have died needlessly in British hospitals due to poor health care. Britain's National Health Service is a renowned institution but has been criticized for years. And as John Waggie reports, the new report adds more fuel to the fire.
The report accuses the National Health Service of poor care in at least 14 hospital trusts and says many patients have died as a result.
I can't remember the good times at the minute, so it breaks my heart.
It's an emotional topic for Rebecca Asplin, whose mother had a blocked bowel and died at home after being discharged with pneumonia from a British hospital.
There's no need for her to suffer like that just for a blocked bowel. You know, food and fluid, everybody needs to survive.
Sharon Walsh has one word to describe the care her late grandfather received.
Appalling is a word that I would use. Grandad went in trusting that people would look after him, give him basic care, give him the respect and dignity he deserved, and he didn't get any of that. Grandad was shunted about like a suitcase. 9 moves in 12 days. It was as if he was just part of the furniture, literally. He was just always there. So no one seemed to sort of acknowledge or take any notice, and they certainly didn't take accountability of his care.
The UK's National Health Service is so much a part of the country's fabric that it was celebrated in last year's London Olympics opening ceremonies, with a worldwide audience in the billions. But the latest reports of bad management and poor staffing make it a political hot potato in Parliament.
It is never acceptable for government ministers to put pressure on the NHS to suppress bad news, because in doing so, they make it less likely that poor care will be tackled.
The report is a headache for the Prime Minister.
Frankly, we don't serve our NHS if we cover up wrongdoing and problems. We've got to look at those problems. We've got to look at any instances of poor levels of care or poor management, and we've got to deal with them.
Officials insist that they have made progress in care over the past 2 years, but the latest report reflects badly on the country's health bureaucracy, which is the 5th largest employer in the world. John Waggie, CBN News.